All right, I'm just going to go ahead and get started here. Really appreciate everyone taking time out of their inevitably very busy days and schedules to join us for this webinar. We're going to go over Loom Health Telehealth and kind of how that applies to this new reality in the era of COVID. So let's go ahead and get started. I'm going to do a brief overview about Luma Health for those who may not be as familiar. Luma Health, we are a total patient engagement platform designed for providers and patients to maximize patient outcomes. We were really built because, we're all patients and we believe that it should be easy to see and connect with your doctor to get the care you need when you need it. So our platform is built for kind of the whole patient life cycle, if you will, around patient access, communication needs, from patient scheduling to patient communication and everything in between. And with that, I'm going to have our two speakers introduce themselves today.
Hi, everyone. My name is Tashvina Gram, the Chief Medical Officer at Luma Health. I split my time practicing as a physician and then also helping out the company on various needs, including content and doing webinars like this. I'm excited to join you guys here today. And Chuck, I'll let him introduce himself.
Hello, everybody. My name is Chuck Leiter. I'm the CIO, of Houston ENT and Allergy in Houston, Texas. We've been using the Luma platform the last couple of years and a lot of the add-on components. And I'm here to talk to you about some of our successes and what we've done, and hopefully give you guys some ideas of how you can implement it and make things run smoother in your practice.
Thank you, guys. And just before we continue, I want to let you know if we have time at the end, we'll definitely take some questions. If not, you can always put them into the Q&A section here, and we'll also be posting both Dr. Ekram's and Mr. Leiter's emails at the end for any follow-up questions we don't get to. All right. So today we'll be talking about and demonstrating the impact of texting on patient experience through the lens of Houston ENT, how to produce operational efficiency through EHR integrated messaging of patient data, and report on some best practices to implement a comprehensive access solution, specifically with telehealth.
Perfect. Thanks for the intro. So I'm going to start talking a bit about what our solution offers in terms of telehealth. As everyone knows, now that a lot of our visits are being canceled, and to ensure safety of patients and ensure safety of staff, a lot of workflows have been transferred over to a telehealth workflow. So I'd like to talk today about specifically what we are offering and kind of some of the learnings that we've had in building out our telehealth platform. And as Marissa mentioned, one of our key tenets of our platform is to make it easy access. And what that does is a lot of our engagement that happens even outside of the telehealth experience is actually driven through the phone. It doesn't require any app. It's very lightweight. And so we've taken that same core concept of allowing patients to get access without being app focused or having the patients to download anything, so be able to get access through whatever they have at their hand, which is their smartphone. And so our telehealth experience, as you can see here, it doesn't require you to have an app. It doesn't even require you to have a login or a portal. It does not require you to even have set up an account ahead of time. And so you can really drive these telehealth experience with a very broad range of patients. Really all they require is having a smartphone or having a device, this could be a computer or anything, with a camera and a mic. And once they have access to that, you can drive that complete experience without having any downloads ahead of time or any real preparation around it. And we do a lot of our communication over plain text messaging. We found that that is the best way to engage patients. You get read rates within the first 90 seconds. You get response rates within the first 3 minutes. And so it's a great way to engage patients and share the access to this virtual telehealth room. And so you can see here is a sample kind of message flow where the patient's gotten a message telling them, hey, you have a telehealth visit coming up. And then here's a link to click on it. And then they have just a simple call to action, which is just a simple link that you click on, and then it launches that application or not even application, but the telehealth visit right on their phone. And then it becomes a very seamless experience for the patients. So that we are able to really drive that high conversion rate. And what we found is that the more we ask patients to do things ahead of the appointment in terms of downloading things, it starts to drop off because either devices don't support it, patients don't understand what they need to do. So to try to simplify the process as much as possible is what we have found is it really helps drive that appropriate interaction between the patient and the provider, and make sure that we get the eventual health outcomes we need. So that's kind of from the patient side. Now switching over to the provider side, we wanted to also seamlessly make it very nice and very easy access. So prior to the COVID, there were requirements around providers having to do these visits from their own facilities or from where they practice. Now a lot of those rules have been lightened. And so a lot of physicians don't actually have access to similar kind of whether it's their desktop computer with a camera or whatever it was that they were using before. And so similarly, we wanted to drive a very easy experience for the provider where they could be able to access the telehealth right from whatever device they have at home. So really all they really need is a desktop computer or even a phone with a mic on it and a camera. And so what you can see here on the left is a screenshot of what the provider experience would look like. We've tried to simplify it so you can see where the provider, when he's logged in or he or she is logged in, they can see all of their appointments that are scheduled for today. They can find out quickly which one of them are the telehealth visits. And then the simple button appears, like that dark blue button in there, as a second appointment, which tells you, okay, this patient, this appointment is live, and go ahead and join it. And once they click that join, right within that same view, a video feed will pop up, and then you'll be right within that telehealth and be able to conduct it. And then, as you can see, you have controls there, like most telehealth platforms, to help you, mute the microphone, mute the video, whatever you want to be able to do. Now, one thing that's really core about our offering is that, and which sets us apart a little bit from some of the other telehealth offerings, is that you can use our service as a standalone service. But what we have found is that maybe in the acute setting, having a standalone telehealth service can help you accommodate that quick switch over from the real or in-person appointments to virtual visits. However, looking forward, I would encourage everyone to think about how do you plan to integrate this into your existing workflow. What we have found, a lot of the clinics at first were trying to juggle two schedules. You're scheduling a patient in the telehealth side, which doesn't necessarily integrate with your EMR, and then you're also trying to schedule a patient that same visit in your EMR or your practice management solution. What we'd like to do is we want to be able to marry those two processes together and be able to leverage the same workflow that you're already using. So what we can do is when we sit on top of your EMR, we can drive the same kind of workflows that you would normally see when you're scheduling an appointment. And so, for example, when you schedule right now a current visit, you would schedule it similarly for telehealth. And on our side, when we're syncing with your data, we would detect that visit as a telehealth visit, and then we would streamline all of the stuff that happens after it. So we would automate the message flow to the patient, we would automate the message flow to the provider. And so really for your scheduling staff, this would really not mean they would need to do any sort of change in their workflow. They could continue to schedule just like they schedule any other visit. And we would take all the hard lifting of making sure that the patient gets that link, making sure that the provider gets that link, making sure that that is a secure link only that's shared between the patient and the provider.
Apologies if I'm a slide behind here, Tashfeen.
Oh, no, it's okay. One other thing that I want to just mention on our capabilities on the previous slide was that the way we've built out our workflow is that it can be telehealth vendor agnostic, and that's kind of what's being outlined at the bottom right here. So if you don't have a telehealth provider, you can use what our solution is. So in the backend, we're using Twilio. But if you already are an existing customer of Zoom, existing customer of WebEx, if you're using Microsoft Teams, we can help you automate that process that I was talking about. So those messages that would go out would not be virtual health links to the Luma Health version of telehealth, but it could be to Zoom. And so what that does is it helps you automate that workflow so that you don't have to manually share the link with patients or call them up. What we've seen some of our clinics do prior to they came to us is that they were, for example, using Zoom. And then 10 minutes before the appointment, a scheduler staff would call the patient and say, here is your room code or room ID number to. And so what we can do is that we can completely eliminate that whole process such that that's shared automatically. So that way you don't have to do that process. And in addition to that, we can also we can do some messaging even prior to the appointment, make sure the patient's prepared. So if, for example, you are leveraging Zoom, you want to make sure the patient downloads the app before they get there. And so we can send a message automatically like a day before that says, hey, make sure you have Zoom on your device or you're at a Zoom-enabled device. All right, we can go to the next slide. So now kind of piggybacking on some of what we were talking about in terms of driving a lot of this interaction right out of your EMR. And so Luma Health, a core tenet of Luma Health is that we will sit on top of EMR, and we want to really optimize workflows and not create more work. And so we can drive a lot of this messaging when we're able to do a two-way syncing with your EMR, and we work with almost 75 different EMRs out there. We can extract the data that we need, that includes patient name, patient contact information, and appointment data, and then be able to message that patient with the appropriate messaging. So in this case, it's to let them know that they have their telehealth visit. Other things that we offer is, you kind of see an example here, is that if you are if you are a specialty care and your referral, you have referral streams coming in, you want to be able to automate that outreach. We can also do that, where when a referral hits your EMR, we can automatically start reaching out to the patient rather than you having to pick up the phone and starting calling patients. And then what that does is, when those patients are getting the message, they can quickly be able to either call back, and we can help you track all the patients that are being referred to your clinic, or they can even be put towards a web scheduling component where they can self-book and be self-serving, so that way you can drive some of that increased conversion into appointments. And then another one of our features is appointment reminders. And what really sets us apart from some of the other providers in the appointment reminder space is that we found is that when you're sending text messages to patients, patients don't often realize what they're getting is a message from a robot. But rather, because they're so used to using their phones for conversation with their friends and family, they assume that the message they got is actually from another human being. And so what we will see with some other of the appointment reminder services, they will ask the patient to respond with 1 for confirm, or 2 to cancel, or yes to confirm, or no to cancel. What we found is a lot of times patients don't respond with that. And as you can see here, the patient responded with a thumbs down. They'll respond with emojis. They will interact with these messages as if they're talking to a human being. And so one of the core capabilities that we built on working with over 1 million patients on our platform is being able to help understand what the intent of the patient is, and to be able to really drive that real-time conversation with patients. And then not just that, then taking it to the next step of allowing patients to rebook. So in this screenshot, you can see here the patient canceled, but this is a great time to make sure that we don't lose this patient. So we offer them more appointments so that they can book another appointment. And then we have a capability of doing mass messaging and being able to be a platform to be there when the patient needs to be, when the patient needs you as their provider there, even though we are not physically able to connect with our patients. So this is an example of where you can send out broad messages to patients, communicating at this time when we have a difficult circumstance of, hey, our clinics are closed, but we're here to help. Here's some information that you can do to stay safe during these times. We've seen use cases around where the clinics would like to let their all their patients know that here are the service lines that were still enabled, or here are if you are having any symptoms, here are ways that you can help get connected to our providers, even though most of our service lines are closed. So being able to seamlessly communicate with patients, something our platform can empowers a lot of our clients to do. Now, going back to kind of the telehealth, I think we've talked a little bit about this, but with the telehealth experience, we can drive, automate a lot of that patient communication that needs to happen. So we can understand that, for example, this patient's been booked for this appointment type, which is marked as a telehealth appointment type. And so once we understand that about that appointment type, we can then do all the downstream messaging, which would be sharing the link with the patient, making sure the patient is prepared for the telehealth visit. And again, we've taken what we'd like to call is like a telehealth vendor agnostic approach. So if you already have an existing telehealth vendor, then we can leverage we can leverage what you're already doing there, but help you streamline that workflow of patient messaging and communicating and coordinating it. And if you don't already have a telehealth vendor in place, then you can definitely use what we have built into our product or platform. Now, one of the things that I'd like to emphasize here is that one of the big problems that we've seen early on with some of the other providers is that patients sometimes aren't before the telehealth appointment happens, they don't know that they should try to make sure that their device is properly enabled or they have the appropriate access to be able to actually conduct a visit. And so what you're seeing here is kind of the patient experience. And the way it would work is that the patient, once they click on that link, we do a quick check to say, hey, does your device have a camera? Does your device have a microphone? Does your device have a speaker? Are you using a browser on your phone or on your computer that will help to facilitate the interaction? And we found is a lot of what happens, unfortunately, is either they're on a device that doesn't have an appropriate phone, they're using a web browser that's outdated, or whatever it is. But then this lets really help the patient take control of what the experience is in terms of understanding, hey, why isn't it that my phone is not working? And so what this does is that what's the worst situation is that the doctor is ready in front of their computer, ready to have a televisit, and the patient just didn't realize that they needed to have their phone next to them or whatever it is. And so now you have this 30-minute block time, and now you're kind of doing IT support to try to, at the last second, trying to figure out how to do this. And so what we've done is we've created tools and messaging that can help the patients more or less self-serve themselves ahead of time. So that way when the time the appointment comes, they're ready to go. And now kind of more talking about what we can do with telehealth in the current state, which is obviously with the coronavirus or COVID-19 that's kind of widespread. What have we seen folks doing, and where can telehealth fit into this? Certainly, this is a challenging time for many, and I think a lot of our clinics that we've been talking to, one of the biggest challenges around this is that not only have they had to cancel a lot of their existing appointments because of patient safety and staff safety, and that obviously has an impact on patient care, but it also has an unfortunate impact actually on the bottom line for clinics. And as probably most people know, a lot of the rules around telehealth have been lightened. And so a lot of the rules that were in place for what kind of telehealth visits you could do before, and what devices you could use, etc., and how they would bill for it too. A lot of it have lightened in the current state, just to help facilitate and help providers continue to deliver healthcare. And so what we have seen is a lot of our clinics in the acute phase, in the early phase, just did a mass canceling of patients and just rebooking them to much further down the line. And now, as they've kind of ramped up their telehealth efforts, they've started to identify here all the patients that should have been coming tomorrow or that we've canceled. Which of them can we convert over to telehealth visits? And our platform allows you to be able to do a lot of that and automate that workflow. So you can, for example, say, I want to find out all the new patients that were scheduled for the next, that were scheduled for the next one that I've canceled. And I'd like to figure out which of them I can convert into a telehealth visit, for example. And we can automate the communication. We can automate the identifying of those patients, automate the communication of those patients, letting them know, hey, look, unfortunately your appointment did get canceled, but which of these appointments can we convert into a telehealth visit? And we can do the engagement prior to that, where the patients will get the appropriate messages. Like, for example, you can ask them the appropriate question of like, what was your reason for visit? Can we delay this visit to later, or can we not? And so you can help to filter out, to figure out which of the patients and triage which of the patients that are waiting for appointments would be appropriate candidates for telehealth. And then to completely streamline that process, you can even have them self-serve. And so when they're asked these questions in an automated way, and then when they fulfill the criteria that you have identified as a good candidate for a telehealth visit, they can go and schedule that visit right from their phone in the convenience and have that streamlined appearance and the ease of getting access to those appointments. And then again, going to the next slide.
Sorry about that. Here we go.
And then, one of our core tenets, again, is all about making sure that we have a real-time integration with ER, because with your EMR or your practice management solution, realizing that is the source of truth, and realizing that is really the lifeline for our clinics. And so everything that we've built it can be used in an isolated environment, like our telehealth service can be used outside of an EMR, can be used outside of practice management solution. But we realize is that oftentimes doing these kind of things creates more work. And our real goal is to empower the existing workflows that you have and to be able to help drive the patient experience and not create more work. And so we, the way we will sync all this data, pull and push data out of your EMR and make sure that everything stays in sync. And so things we pull and things that we pull out of EMR, not only patient demographic information and appointment data, but we also pull out billing codes to really help you customize that messaging to patients.
I think I'm just going to skip ahead here a bit so that we can hear from Mr. Leiter.
Yep, sounds good.
No problem.
And we can share this deck later. So let's get started. Let's see the results.
Sure, you bet.
Houston ENT.
Yeah, I think in just talking about our results and our outcomes, just a little background on us. We are a practice that started practice in 1907, so we've been in practice for over 113 years. So, and over that time, I can tell you we've had a lot of outdated processes and technology, and we've come a long ways in implementing Luma. We've been on Luma for the last few years. We're currently a next-gen shop for both the practice management and the EMR software. And I don't know what the breakdown on the webinar today is as far as existing Luma customers and those looking at it, but I'll kind of go into both. But I would think as we've been on the Luma platform for a little while now, we've actually used about a total of 3. Maybe some of you guys have done that as well too, and trying to discern which is the best one. And I think as you look at the results of what you want, I think what really comes up is for you guys is you really look at that and as far as the outcome of, do you have happy providers, and do you have happy patients? And just to pull a review online that we got from some of our results, Dr. Morrison, this was not too long ago, it said something to this effect: Dr. Morrison spent all the time required and answered all questions during a telemedicine visit resulting from the COVID-19 stay-at-home time period. The RX was acknowledged and supplied within minutes. Very professional doctor, very professional visit. And that's kind of the result that really you want to obtain. And in doing so, you have to do a few things. I mean, you have to take a look, and we did it at our existing process for seeing the patients in the office and contemplating how that's going to change, and maybe it already has changed with furloughs and reduced appointments. And not forgetting, if you're thinking about any of this technology, your analytics for any type of no-show appointments, because as few appointments as you're having now, especially with televisits, I mean, you certainly want to make sure you're using the right cadence with an appointment reminder system like Luma has to make sure the appointments are they're teed up and ready to go and ready to be seen in a timely manner. And not forgotten, because every appointment right now is so crucial because there's so few coming through for sure. And also a result is, you want a smooth implementation and not a drawn out, bumpy road, and providers are irritated, and you might get some bad reviews from patients if you don't know exactly what you're doing, because you really want to take this as far as you can. And as far as, the implementation on the Luma side, what I've found out so far, and I've done a few of these, is that if you're an existing Luma customer, it's as simple as sending out an email to enroll the provider. It's that easy. It's very simple to get. We've used their best practices recommendations for sending out their text before the telemedicine visits 30 minutes ahead of time, and then 5 minutes ahead of time, which has actually worked out really well. And then Tashim talked about the integration is just fantastic. So the providers have one screen to look at for their schedule. There's no confusion. They can see their telemed visits. They can see their regular office visits. It's made it extremely easy to interact with. The look and feel of it is, I like to say the word Apple-ish, so it's clean, and that's important to simplify. Well, the providers get hit with logging into so many different systems these days, which is very important. So I think as we come across a few things, can we go back one slide for me? Just, let's see, I think it's back. Yeah, perfect. Okay, COVID. I mean, let's just talk about the catalyst here. I mean, this has been the mass adoption of things, vendor considerations. I mean, my gosh, have you seen so many people come out, especially since the relaxed the rules? I mean, I think it was talked about earlier, like Zoom, and people are using FaceTime, and I've seen people use Skype and the WhatsApp app, and there's all types of crazy products you can get. And there's, I mean, the thing at the end of the day, you got to ask, I mean, do you want a bolt-on type of product, which is actually double entry and things like that? Because I really wanted to stay away from that. Or you want to get something that's more integrated, like Luma has been able to do, and that seems to have been a big benefit. So I say try to go that way if you can, because in this post-COVID situation right now, I mean, evaluating your telemedicine, how do they differ from your regular office visit? What's the impact? I mean, determine what your telemedicine mix is. Are you going to go like 50-50? Are you going 100% telemedicine? I mean, from a surgical practice standpoint, the impact is huge. I mean, because for us, I don't know about all the other practices on the line right now, but only 20% of our revenue is derived from E&M visits. I mean, the rest of it, the procedures, the surgery, the allergy, audiology, radiology stuff, diagnostic stuff, is 80% of our income. And I mean, this has been a huge hit for us. And it's hard on us as practitioners, as a practice, our partners. It's obviously hard on our staff, and it's definitely hard on the patients, because some of them they do need to see you, right? And what's really important, I think, if you're out there and able to see patients, is first of all, use the Luma platform. I mean, take it and send out a text blast. And that's what we did, that we are open and ready to see them. And one of the messages that we sent out is we're open for same-day appointments and are readily available. And we care about your safety of your health, and we are open and carefully screening patients and have added telemedicine to our services. Please call to schedule or click online to schedule. And that went out because sometimes people forget maybe that you're open. So use this type of technology to drive business into your practice, because I think you'll find out that it will help you immediately, like it's helped us in the limited amount of visits we're seeing right now today and everything. Also, I think you got to really keep in mind too, when you go telemedicine, there is a mass confusion from workflow of staff and everything, because some people are working from home. Some of the physicians we have are doing this from home. How do you coordinate that? For us, it was challenging, because they're used to the patient walking in, collecting a copay, and then from there, getting the past balances. But now that's all changed, right? So now we have to, ahead of time, have the front desk virtually call the patient, talk to them about their balances and their copays, and go from there and take it. And then what we've done is we implemented a new workflow to be able to alert the physician that they're ready and teed up and ready to go for you. So I think you'll really have to look at your workflow from both your provider standpoint and where they're working from home or from in the office, and make those consider thoughts as you go through it. Other things we've had to do, you'll have to do as well too, is you'll have to create new appointment types. We didn't have any telemedicine new appointments or established. You'll have to create those. You'll have to coordinate that type of text message delivery to make sure they know it's a video visit, not come to the office. So there's any type of confusion on that. We also had to add some EHR visit types, such as telemedicine, virtual, and e-visits, which we didn't have before. But you will have a lot of implementation challenges into this, because you're going to be dealing with so many end users. I mean, today we took a call from a person who had an iPhone 6. That is not compatible. The iOS is not compatible. Having the tool that Luma has to tee up the patient to check off that the microphone's ready, the video's ready, is hugely important for your patient satisfaction, but B, your provider, because they don't want to be, Tishim talked about, they don't want to be the tech. And it's very frustrating. And have them be able to get that to them, as the patient, as soon as possible, is hugely important when you're sending out your cadence of your text going out. There's a lot of different iOSs out there. They're not all going to work, and you have to be prepared for that, because a lot of people have, when you go into the settings in Safari, they're all set to deny or always ask on everything, and sometimes they deny them, and then the provider can't see the patient. So you have to use the technology that Luma has to open that stuff up, to tee it up for the provider to get started on time, and that's been a big challenge we deal with as well. As far as the delivery of the text, I can say that getting it 30 minutes ahead of time is ideal, and then 5 minutes before the patient, and there's no confusion on when things start. But keep in mind too, always as you go through the visits, for your provider documentation for televisits, to make sure that they put some type of wording in there that in the document that they're using, some telehealth technology. We actually put in there they are like using Luma Health, and we advise them about, the limitations of telehealth. And we also put in there that the patient was like at home or with their husband, and then the physician was either in the office or at home as well too. So there's all the documentation is done. On telemedicine, something also to consider is the limitations of the physical exam. There are limitations, and we can only cover, as an ENTs, like constitutional head, face, nose, mouth, throat, and very simplistic neck exam, range of motion type things. And so you're limited, and then that will drive, a lot of different things you have to deal with as far as the coding. In the telemedicine world today, the payers, the eligibility is tricky. I mean, some plans cover a lot. The biggest problem we're running into is some of the plans that are self-funded. They don't. They want you to use their telemed provider. And these are things you have to think about. Do you want to still keep the relationship with your patient and do that? Now, we came up with, a self-pay rate of, $80 for a new and established, which we thought was very reasonable, and it seems to work very well. I'll let you think about what you want to do in your own practice. If you have a telemedicine visit, one of the complications, and you have to bring them in the office, you can't charge for both. You can't charge for telemedicine visit and bring them in the office visit. So we have tried to, the office visit obviously pays more, so we take that one, but that's another thought. In case they're talking, they have to carefully screen them and bring it in. So those are a lot of things that are going on. As far as reimbursements, we are getting paid for Medicare, Blue Cross Blue Shield. The highest we've been able to do is, on a new patient is a level 3, and then non-established patient a level 4. And for some of the payers, it's all over the place, because I guess they're in some different states, but Medicare has been kind of consistent. But I would say for best practices going forward, as you go through and implement this technology, is start with a small number of providers and test it out and test your workflow out, because I think you're going to have to come up with new policies and procedures for telemedicine workflow as you go through this process. And you might want to dedicate a person in your office that as things arise, because most of it's going to be on, the patient side, or sometimes we've had providers that have had older iPads with outdated iOSs, trying to get that all figured out before you roll it out to all the physicians, get all their equipment up to date, so you can make for a, smooth transition for your providers into this new world, and try to also keep the patients happy by testing ahead of time to open up all their microphones and video cameras, and then it will facilitate. And the end result is, if you kind of go through all this process, you'll see that you will still get positive Google reviews. And I will say, even though I think a lot of the physicians we have in our practice are very frustrated that they can't do more from it, but they are finding that in talking to the patients, it's very reassuring. Like we had one person, they had a growth inside their mouth, and the physician saw it and realized it was not any type of cancer, that it could wait a couple of months, but it certainly did reassure the patient that it's okay. They didn't need a risk coming into the office, and we would take care of it when things calmed down. And so that's kind of my recommendations as you go through it. If you have any questions, please feel free to email me. I'd be glad to visit with you in more detail about it, from all the joys and the pains of the process, and what we're running into with patients, payers, and obviously our physicians. And I thank you very much.
Excellent. Thank you so much for all of that insight and how Houston ENT is utilizing telehealth right now. And we've gotten a few good questions here. I'm going to follow up with everyone, posting these questions and the answers we have, and in addition to a recording of this webinar, so everyone can have it as a reference. And if there are any additional questions, here are the emails of Tashfeen and Chuck. Thank you everyone for taking the time, and I hope you have a great rest of your day.